Hi everybody, I'm so happy to be here. I've actually spoken and been at every single conference since the beginning, and it's yeah. So I was in Chicago in 2009, so it's wonderful to be here. I am the co-author of the lymphedema book, but otherwise I have nothing to disclose. In this talk, I want you to be able to understand the contribution of inflammation to Derkham's disease and lipedema, and also to evaluate different types of pain, neuropathic pain and nociceptive pain, and explain traditional approaches in the management of pain, and understand pain management and relief of pain requires a multidisciplinary approach. And then also to recognize the importance of lymph drainage and clinical aromatherapy in the treatment of inflammation. So the perception, there are a lot of slides I'm actually going to go over pretty quickly because they've been covered by many people. But the thing with Derkham's, the point I want to make is that there is pain and tenderness and deep pain in the lipomas. And that the sympathetic nervous system may play a role in the origin of this path of pain. And there's neuropathy and joint pain. Lipedema as well. There's swelling and achiness that can be there towards the end of the day, as you all know, and it can be referred to as painful fat syndrome. So what is inflammation? And Karen did cover a lot about inflammation, but the presence of excess fat causes low-grade inflammation to set in, and that results in chemical changes to the fatty acids in the cell membrane, and chronic inflammation leads to pain. So it makes sense that if we can reduce the inflammation, we can reduce pain. So we're going to be talking about different things that we can do to decrease inflammation because it causes pain onto the nerve endings, and then that sends a message to the brain. So what is pain? It's an unpleasant sensory and emotional experience associated with actual potential tissue damage or described in the terms of such damage. It is associated with our perception of the event and influenced by our past experiences. It's very, very subjective. And there was a very famous physical therapist who said, it is whatever the experiencing person says it is existing wherever and wherever the person says whatever they said it does. And this is very important because I'm a lipedema patient too, and many of us have been to doctors who've invalidated what was going on and really not understood what the pain is. But really the pain is very, very subjective, and the process of pain perception is very personal, and it's dependent on the individual's past experiences, cultural and also psychological state. And pain that lasts for a short period of time is acute. And if it's chronic, it lasts for about 12 weeks or longer, is what people are saying now. And other health problems come from pain, such as fatigue. We've spoken about sleep disturbance a lot today, decreased appetite, mood changes, and those all accompany chronic pain. And I'm going to share some information with you, lots of aromatherapy to help you with sleep and some of these pain problems. There are many models of pain. This is one model of pain by Losa. And you have the pain stimulus, which is nociception, and then you have the feeling of pain. And that is also based a lot on our attitudes and our belief. The next level is suffering, and that's the psychological component to pain. It's very unpleasant. Then we convert it, and it's how we communicate the pain, and then how we interact in our environment with that pain, what we do with it. So what influences the pain is physical, psychological, social, cultural, and spiritual dimensions. The way we perceive pain is different in different cultures, and also family support can help you to deal with that pain. And so your environment is really an important plays an important factor in how you deal with that pain. Sleep, of course, as we said, influences nociception and pain perception and behavior, which can lead to exhaustion. And then anxiety and stress can also lead to further pain. So it's very clear from all of this that we really need to have a multidisciplinary approach to the treatment of pain. When I work in my clinic, that's what I do. I work with everybody in a multidisciplinary approach. We work with diet, we work with the lifestyle, we work with stress management, management, and then I do the medical treatment that I'm trained to do. There are also a lot of psychosocial issues that make pain worse, and that is worrying and less out of control. And before you've had a diagnosis, you're worried, you don't know what's going on. You also might have financial worries. How are you going to pay for this? A lot of this is out of pocket, not covered by insurance, and difficult living conditions, and all of that contributes to the pain. And then a person's spiritual well-being highly influences all aspects of that pain. What inspires you and gives you meaning? And people who are saying, why me? And they just succumb to it without doing things positive to help you to overcome this pain and your personal convictions or beliefs. One person will say, this is really bad, but this is what I'm going to do about it. And I'm going to grab this by the hands, and I'm going to take action, and I'm going to see the necessary people to help me. And another person will just be saying, oh my goodness, why me, poor me, what's going to happen to me? None of you, because you're all at this conference, seeing what you can do to help yourself. So there is different kinds of pain, and then we'll go into detail, but I'll go pretty quickly through them afterwards. But neuropathic pain is caused to damage to the neurons that are involved in the pain signal pathways in the nervous system, and nociceptive pain is caused by damage to the body tissue, and it's usually described as a sharp, aching, or throbbing pain. And when they're activated, they send electric signals of pain to the nervous system, and then the brain delivers the perception of pain. So if we can work with tools to change that perception of pain, the pain may be less and can be less with the tools I'm going to show you. So neuropathic, as I said, is shooting, burning pain. It can be chronic, and it's damage to the neurons. And it can go away, but sometimes it's unrelenting. And you can get peripheral neuropathy. And many patients do have peripheral neuropathy. And it can be sharp and jabbing or freezing or burning. And there are traditional treatments for that, analgesic medicines, but they don't really provide what you need to have done. Acupuncture can be very helpful, and physical therapy. You can also take a warm foot bath with Epsom salts, which will be very, very relaxing. And the magnesium can also help as well and help the fatigue. You can add essential oil to the water. And then I have a blend that I use with my patients for neuropathic pain. And these are essential oils. Helichrysum, which is very anti-inflammatory. Clove, which is analgesic, but you have to use that in low quantities. It's really strong. Peppermint, which is also analgesic and increases circulation and helps with pain. And sweet birch, which is anti-inflammatory. You also need to use that in low proportions. Black pepper increases circulation. And blue cypress oil has camazulene in it, which is very, very anti-inflammatory, and lavender is very soothing. I'm also a clinical aromatherapist. I didn't tell you all that. So curcumin is an herb that is anti-inflammatory, really good for our bodies, but can also help the numbness. And then what I have found works really well with my patients with neuropathy is to take vitamin B12 and alpha-lipoic acid. That helps amazingly. And then nociceptive pain describes the pain from physical damage to the tissue of the body. And it's caused by potentially harmful stimuli being detected by nociceptors around the body. Inflammation and myofascial pain form part of this. It's usually well localized. Traditional medications, we all know these, most people have done them, but there's better things that you can do because a lot of times these don't work, or you have to start taking higher amounts. And then there's prescription pain relievers, naproxen, ketoprofen, and then Dr. Herbst often recommends amphetamines, calcium channel blockers, and methotrexate for the inflammation. Vascalera reduces inflammation, which can help reduce the pain, and antidepressants. You can also have surgical removal of lipomas, lidocaine infusions, and acupuncture. But none of them really have long-lasting effects. So we know that we have to have a multidisciplinary approach and an integrative method of pain management. because with that inflammation, we have pro-inflammatory cytokines, and Dr. Herbst has already referred to this, so I will go on, sets up this biochemical reaction, and we have a chain of pain, and the pain gets exacerbated, and that is nociceptive pain. And then that results in fibrosis. You can use myofascial release. You can have therapists who can help you with myofascial release, craniosacral, ASTEM therapy, Graston technique, Tuina, and gua sha. In this small, short talk, there is not time to go into more details with all of these. This is amazing. Frankincense essential oil, but actually the resin from the frankincense is high. It's boswellia that it has in it, boswellic acid, and it inhibits the enzyme loxandase, which reduces inflammatory signaling. And then it also reduces NF-kappa B, so it slows down inflammation. The human body has an endocannabinoid system that receives and transmits signals from cannabinoids. And the endocannabinoid system helps to relate functions such as sleep, immune response, and pain. CBD binds directly to the CB1 and CB2 cannabinoids in the body. This is from the hemp plant. It does not create you a feeling of high or psychoactive, but it has great potential for pain relief. And evidence suggests that it can be used for anxiety. There's a lot of studies going on right now in a lot of the major universities about the use of CBD for inflammation and for pain, and it's wonderful. Manual lymph drainage is really fantastic for pain management, and you should be going to your therapist for this. Compression, of course, skin brushing, all involves antioxidant stress and anti-inflammatory effects. When we do the manual lymph drainage, our pressure and release technique that we do blocks the nociceptors in the skin, and it blocks pain in the brain. It sends messages to the brain because it works on mechanoreceptors, which then block nociceptors and blocks the pain. So it's fantastic. It also has a brings down the sympathetic activity, brings up parasympathetic, so it helps with stress. I'm going to go very quickly through the supplements that are for inflammation, vitamin D, metformin. With diet, please avoid sugar, wheat, and high glycemic foods. Have an anti-inflammatory diet. Bioflavonoids are also very helpful. Dr. Herbst already spoke about the NAC and about the enzymes. I have my patients all take these enzymes. They really can help reduce chronic pain by reducing the fibrosis. And aromatherapy can have a very, very positive effect on pain management because it enhances the parasympathetic response, and relaxation has been shown to actually help to reduce pain. There have been many studies with nociceptive pain versus inflammatory pain, and in this one particular study, there were 5 studies, they found that the aromatherapy really helped more with the nociceptive pain than the anti-inflammatory pain, but there are other studies that essential oils have helped with inflammation. And when you smell lavender or jasmine, it's a whiff that takes you right back to your childhood. So odors can really transport you to different realms and really help to get you into a really relaxed and amazing state and really soothe your body and help you to relieve pain and actually release stress. They can boost immunity, trigger memories, affect a deep healing, and also they are anti-inflammatory and they help with pain reduction, and there are different oils specific to these symptoms. Lemon is anti-inflammatory. Geranium and lavender have also had said to be anti-inflammatory effects, and these are all studies. I'm on a research committee for a National Aromatherapy Association, very serious studies. And when you just inhale, it goes right to your brain 5 minutes after you've inhaled an oil. The research is showing it goes straight to your brain. But you don't need research. You can just smell it and you can feel the results. When you incorporate essential oils with manual lymph drainage, you get an even better effect. And peppermint, cobaba, and ply actually help tremendously with pain. This was a study done with aromatherapy massage, helping with neuropathic pain and lowering neuropathic pain and helping quality of life. With chronic knee pain as well, which can lead to functional impairment. There was a double-blind study showing that ginger oil was very helpful together with the massage to help with the pain. And then I'm going to have to go quickly through this because I don't have a lot of time left. But I took the different symptoms that mostly Durkheim's patients get, and I worked different essential oils that could go for those. So for headaches, lavender and peppermint. Numbness, I already told you, a neuropathy blend. Nerve compression, you can use chamomile and lavender. For circulation, cypress is fantastic, and juniper is really good for water retention. And then for inflammation is cacao, which is a resin, and Roman chamomile and lavender. For pain, there's St. John's wort, lavender. Joint pain, sweet marjoram. Muscle pain, marjoram, rosemary, and lavender. And then for fat tissue pain, there's copaiba balsam again, and ginger, and Roman chamomile. Deep breathing is really, really important, and we've had some wonderful lectures here with Edalie. When you breathe diaphragmatic breathing, you're working the sternochyli and you're helping the flow of lymph. You're lowering your stress levels, and it helps to reduce pain. Some therapists work with deep oscillation, which is called the Heaver mat, and that has shown to be really, really helpful for edema and also for pain. And the cold laser can be very helpful as well for pain. Photobiomodulation has actually been used for years on sports injuries, and there have been many, many clinical trials on this, not specifically for Durkheim's, but I feel it can be really good for that. Whole body vibration, I have a unit in my clinic, and it really has helped to reduce pain and inflammation. We're needing a lot more studies on that. I was just in Tahiti, and I sat there in that I was a private island on the Motu, and I sat there for 2 hours just doing nothing, and I have such a busy life, and it made me realize that I have to bring this into this talk. It's really important to be mindful, have mindfulness, and be in nature. Very important. That will also help to reduce your pain. And in Japan, they're doing things where they're connecting with nature, and they're doing forest bathing. I did a whole workshop on this a few weeks ago. It's so amazing. So go into the forest, hug the tree, or go into your local park, or go into, we have a botanical garden in San Diego, and enjoy that. And these are some other techniques: mindfulness, aromatherapy, guided imagery, visualization, laughter. When you laugh, you're releasing endorphins, and you're also moving lymph, and you're calming the mind, and you're going to help with pain. Some people need psychotherapy. I send some of my patients for hypnotherapy. I don't think I put that there. Acupuncture can always be good. And then the exercises, the Watsu and the yoga and the Pilates, that helps you to get out of your mindset, and by stretching and moving the fascia like we do in Pilates. I've been going to Pilates for 8 years, and my body has changed completely since I did that. And back to the meditation and the guided imagery. This was also from Tahiti. It was so wonderful. But the most important thing is to embrace yourself and love yourself, because you are beautiful. And when you feel that, and you know that, and you feel that, that's also going to help to reduce that feeling of pain. So a summary of what we've spoken about: we need a multifaceted approach. Manual lymph drainage can be very helpful, is very helpful. Aromatherapy, whole body vibration, yoga, mind-body connection, your diet, aromatherapy massage, stress management, meditation, going into nature, herbal medicine, deep oscillation therapy, cold laser, CBD, and love. And this there, where it said yield to the present, I was actually at a 5-day retreat where we weren't speaking at all. It was a meditation retreat. And I was walking around the grounds, and I saw that, and it said, yield to the present. So I think this is my message to you all. Go into nature, hug a tree, and yield to the present of what is happening right now, and where you can be going, and what you can be doing with your life, which is amazing things. I thank you very much.
We've got time for questions. How does one find and select a reliable, effective form of CBD oil?
So this is a challenge because there are so many companies there's so many different standards, there's different methods of extraction, and when you read something, you don't really know what amount you're getting. So I have some companies I could help you with. I'm not related, then I don't financial at all. If you'd like to contact me, I can help you. But you really need to get good quality. It needs to be organic. Properly extracted, and they've got to have on the label exactly what percentage is there. I send a lot of my patients to a nurse that I work with who helps them with the quantities that they're going to be using and how to slowly get on.
Okay. Will CBD show up in a drug test?
No, if you put it on the skin, it will not. The CBD legally to be Schedule 5, which it was just changed from Schedule 1, has to have less than 3% of the THC. And my understanding, and I was actually just at a big lecture last week, was that topical will not show up in a drug test. It's possible that the 3% might.
Okay. Can you take NAC if you have fillings in your teeth?
We'd have to ask Dr. Herbst that. I don't see why not, yeah.
Okay. What do you do with the clove oils? Do you just put it in a diffuser?
No, clove oil is not for a diffuser. The clove oil and the copaiba balsam and the ply and the oils of peppermint that I said to you to use for pain is blended in a carrier oil. We never put the oils directly on the skin. There are a lot of people selling oils who honestly don't know what they're doing. You want to go to a trained person, but you dilute it in an oil, and usually you'll do about 8 to 10 drops of essential oil blend in half an ounce of a carrier oil. And the carrier oils would be coconut oil is a good, easy one to get, fractionated coconut oil. Don't put it too high because you'll burn yourself. And you don't need to because it works so effectively.
Okay. Well, thank you very much, Linda, and we appreciate it.
Thank you.